Hi everyone, my name is Kyle Tsai. I'm one of the fourth year residents here at Northwestern Memorial Hospital in the urology department. This year is our research year, and so we have 1 month of clinical duties, but the rest of the year is dedicated to research. And for my research year, I'm working with Dr. Amy Krambeck. She's the chief of endourology here at Northwestern. And so she specializes in treating patients with complex stone disease as well as management of BPH. For our project this year, we have a bunch of different projects going on, mostly in the clinical study space. But the one project that I'm really focusing on this year is a randomized controlled trial on studying patient outcomes for patients undergoing HOLEP for BPH. And so we're essentially randomizing patients into traditional HOLEP versus getting a HOLEP plus intravesical Botox at the time of HOLEP, and seeing if patients who have baseline overactive bladder type symptoms have improvement of their symptoms and symptom recovery with the Botox injections compared to patients who undergo HOLEP without Botox. And so that's kind of the main project for this year. But like I said, there's a bunch of different projects that we're working on related to HOLEP outcomes. So we're looking at the effect of bowel dysfunction on HOLEP outcomes. And then we're doing a lot of kind of different chart review projects as well, just seeing how we can optimize outcomes for patients undergoing these types of surgeries. One of the things that drew me to Northwestern was this lab year. It's a good break, I guess, from clinical duties our other years. And I think it comes at a good time during our fourth year. We have a 6-year program, and it's kind of in the middle of our training. And it's a good breather away from the ORs and from taking care of patients to kind of focus on what we're interested in terms of what we want to do in the future in our careers, or just in terms of what we're interested in doing for research. And so choosing your mentor during research years is pretty straightforward. A lot of us are involved in research early on, so during our first, second, and third years, and we kind of figure out what areas of urology we're interested in. And then there's just so many faculty members that are specialized here at Northwestern that really you can find anyone to really fit your research interests and research needs. So I was interested originally in prostate cancer and prostate cancer screening and public health outcomes, but I really gained an interest in like endourology and minimally invasive surgery over the last couple of years, and so I decided to work with Dr. Krambeck on clinical research outcomes. We also, at Northwestern, we have kind of a layered mentorship program, and so not just mentorship with a faculty member that we're doing research with, but when we first start at Northwestern, we're paired up with a faculty member for mentorship in terms of if we need anything as a resident or career guidance or just life guidance in general. And so that's one aspect of mentorship that we have at this program. And then we also get paired up initially with a more senior resident. And so this year, as a fourth year resident, we're paired up with an incoming intern, or paired up with an intern. And so again, it's an opportunity to kind of bounce ideas, bounce questions, and to kind of help people through the process as well. Yeah, I'm looking forward to doing a lot of great work this year, and hopefully getting some papers published, presenting at some conferences. A little bit more about the research year. Like I mentioned earlier, there's 1 month of clinical duties, and so it's a fully funded research year. We do have a month of night float kind of interspersed throughout the year, and so you can kind of divide it however you want amongst the other research residents, but that's really our only clinical commitment. The rest of the year, like I said, is just kind of dedicated to research. So whether that's in the lab, or for myself, a lot of the clinical research can be done from home or from a computer. And so it's been really nice to be able to not wake up at like 5 a.m. in the morning to go to the hospital, and instead I kind of set my own schedule and deadlines. So yeah, I hope you gain some insight into our program from this video. And if there's any questions, feel free to reach out. Thanks so much.